There you go. Okay. Well, it looks like everything is working okay, and so we probably should go ahead and get started here. Um, hi, I'm Sheena Smith, and I am representing AARP here today for yet another very informative session. This one is about the Idaho Healthcare Directive Registry, and we are going to be treated with some good and new information about this registry. So hopefully all of you will benefit from that. This class will go for approximately 50 minutes, and then there's some question and answer period at the end. If it'll help you at all, go ahead and put your question in chat. We'll probably hold those until the end, but if it helps you to remind you, like if I was just having a senior moment a few minutes ago, so if it helps you to put it in chat, go ahead and do that. We also want to just, assume that we'll have everybody on mute so that there's a few interruptions, and also just professional language and professional dress, which a new thing we've had to say here since the pandemic started. So, but other than that, I think just put your questions in chat and/or prep to be here toward the end and get some answers there. I think we have 2 or 3 people on here who can help give you some really good answers to whatever questions you might have about this. Okay, I am going to go ahead and get us started now, and I just want to introduce you to Chris. Chris is the new program manager of the Office of Healthcare Policy Initiatives, which is housed in the Bureau of Rural Health and Primary Care, a division of public health in Idaho Department of Health and Welfare. He recently retired just last year from the Idaho Army National Guard after serving 24 years. Thank you, Chris, for your service. And he has spent the last few years volunteering for nonprofit organizations in the Nampa area, providing food and identifying ways for low-income families to get quality health care. He has a bachelor's degree in emergency and disaster management, and he's going to graduate from BSU here in December with an MBA, Master's of Business Administration. So Chris could answer all of your questions and more, and he will leave a way for you to contact him at the end of the presentation. So I'm going to turn it over to Chris now.
Perfect. Thank you so much, Sheena. Good morning, everyone, and thank you for attending today's presentation on the Idaho Healthcare Directive Registry. As Sheena said, my name is Chris Irizarry, the program manager for the Office of Healthcare Policy Initiatives. I'm supported by my health program specialist, Cynthia Herrera, who's actually here today, kind of helping me man the chat room, if you would. Additionally, health program manager Jennifer Baker, one of her primary roles is managing the directory itself. As a team, like Sheena said, we operate under the Bureau of Rural Health and Primary Care. That falls under the Division of Public Health, which is, again, kind of falls under the Idaho Department of Health and Welfare. This is where the responsibilities and the management of the Healthcare Directive Registry have been assigned. All right, so what is the Healthcare Directive Registry? So it's a secure location where you can create, store, and access your advance directive, where it's visible by healthcare providers, and it's also shareable with family members, friends, or anybody else that you may grant access to those documents. So your healthcare agent. So a little bit of history here. The registry was created approximately 2005, so it hasn't been around too long, and it was stored at the Secretary of State's office. Just recently, 2019, legislature passed Bill 616, which essentially moved the registry from the Secretary of State's office over to the Idaho Department of Health and Welfare. So in that legislature, or in that bill, there were additional requirements that were set that the registry had to meet. So the first one, the registry had to be accessible through a web-based platform, which it of course is. It had to allow individuals to register either online or by mailing in a hard copy of their directives. It requires the site to be accessible 24 hours a day, 7 days a week by both the registrants and the healthcare providers. And it requires the new registry to incorporate the directives that were previously stored or housed at the Secretary of State's office. So some of you may ask, I already had my directive registered with the Secretary of State. So on October 8th, just a little over a month ago, over 50,000 registrants and their documents were successfully and securely transferred to our new cloud-based website. It's operated by Vinca Health, and just a few days later, we were successful in meeting the anticipated go live date of October 12th. So today, currently, we are working with a variety of healthcare providers, legal firms, and of course, customers to add new registrants and to also ensure the transition of those accounts to the Secretary of State's office. Those accounts are both activated and accessible by the user. So recently, more than 50,000 mailers are going to be on their way out to those previously registered customers. It's both to kind of inform them of what took place and then provide some direction on what they need to do next. So although there may be some time there in between the transition when that took place and when you might receive this mailer and activate your new account, just want to assure everybody, if you already have an advance directive that was posted with the Secretary of State, those are still all visible by healthcare providers. So again, although you may not have direct access yet, they will. All right, so quickly, let's talk advanced care planning. What is it? So advanced care planning does not just pertain to a certain age group. As I was telling Sheena earlier, I actually, I'd done this a few times with the military, and but I had no idea that this was even an option available that the state provided to register your care plans. So essentially at any age, a medical crisis could leave you too ill or injured to make any of your own healthcare decisions. And even if you're not sick now, planning for healthcare in the future is an important step towards making sure you get the medical care you would want if you're unable to speak for yourself. And it ensures healthcare providers and your family members are following those decisions that you want. Advanced care planning, it involves learning about the types of decisions that might need to be made, considering those decisions ahead of time, speaking with your spouse or family members, significant others, and letting them know ahead of time what your preferences are. So these preferences are what are put into that advance directive. An advance directive is a legal document. It goes into effect only if you are incapacitated and unable to speak for yourself. So again, it helps ensure an individual's treatment preferences are documented and respected. All right, so why does this all matter? So overall, again, it's a way to be sure that your personal goals and wishes are being carried out. Additionally, it's going to help family members and medical personnel in making important decisions that like the kind of care that you would want or who you want to make certain decisions for you when you cannot. All right, so The Advance Directive, getting started with the Advanced Healthcare Directive, the Department of Health and Welfare has actually created an Advanced Directive planning worksheet. It's not required document to register, and it's not a part of your Advanced Directive. Its whole purpose is just to be utilized as a tool. It's designed to help you identify both your healthcare agents, key information that you want in your living will as it pertains to your healthcare, and then gives you an opportunity to kind of talk about and identify any special provisions that you would like to include in your plan. So now let's just assume that you've talked about it now with your family, and you've finished kind of creating your plan, and now you know what you want to do. So what's next? That's where the Advance Directive comes in. So for those who may not know or be familiar with, an Advance Directive is literally for everybody. It's again, a legal document that speaks for you, and essentially when you are unable to speak for yourself. It's a key piece of the advanced care planning process, and it consists of two parts. So the first part is the durable power of attorney for healthcare. This allows you to name an individual to speak on your behalf if you're unable to communicate or make decisions about your medical care. So these individuals are referred to as your healthcare agents. Their primary job, really their only job, is to tell your healthcare team or providers what wishes you have identified, and to speak up in the case that something is not going according to what your directive states. That way you're ensured that the care that you want to receive is what you, the care that you receive is the care that you wanted to receive. So literally, well, I take that back. Almost anybody can be a healthcare agent. In Idaho, there's some stipulations. So a treating healthcare provider, so your doctor who is involved with your treatment plan, you cannot list him as or her as your healthcare provider. A non-relative employee of your treating healthcare provider, an operator of a community care facility, or a non-relative employee of an operator of a community care facility. So kind of a little bit how I mentioned, the individuals that can't be named as your healthcare agent are those that are directly involved in your treatment plan. So a healthcare agent is not required. However, you should know that if one is not named at the time a directive goes into effect or when a directive is being utilized, the state will have to assign an agent. So in most cases, this is going to be like a social service worker that doesn't know you, may not know the direction that you necessarily want to go in case you have left some information out of your will. So again, I kind of stress the importance of identifying those healthcare agents. So the second piece of an advance directive is the living will. This is what documents your actual choices about any life-sustaining medical treatments that you want or do not want during a medical crisis or at the time of an end of life. So it can also include other directions about your goals and wishes for your medical care. So a living will, of course, is a legal document. It specifies the type of medical care, again, that you want if you cannot communicate your wishes. So a quick little tidbit with that, your advance directive must only be signed by you, and it does not require a notary. It does not require an attorney to fill out the paperwork for you. or a healthcare provider's signature. It is just something that you can do on your own. Right, so new pregnancy options. You might ask why I'm bringing this up. So previously, within the living will structure that Idaho had created, there was a statement that said, if I'm diagnosed as pregnant, my instructions regarding medical care shall have no force during my pregnancy. So there was no option to opt out of that statement. So if you were discovered to be pregnant at the time of while you were incapacitated, regardless of what your advance directive said, healthcare providers would do what was best for that child at that time. So in actually just this year, 2021, a suit was filed against the state, whereas an Idaho federal court determined that that previous statement is not required in the advance directive. So instead, you do have the right to include in your advance directive your actual wishes regarding the medical care that you would or would not want if you do become incapacitated while you're pregnant. All right, so a physician orders for scope of treatment. So as previously mentioned, an advance directive literally is for everybody. A physician order for scope of treatment, or as we commonly refer to as a post, this is a special document. It is not for everybody. And I know it might be a little hard to see. I just kind of wanted to throw up there to sort of show you kind of what it looks like. So the post itself is used for patients that are approaching their end of life due to a terminal illness, or if they have multiple chronic diseases that may impact their longevity. So this form, it must be completed by and signed by you and your healthcare provider. So this is not a form that you can ask for at an attorney's office. So because a post is a medical order, for comparison's sake, you can kind of look at it like it's like similar to a prescription pad. It's a protected document. So this is why on our webpage, it's not a form that you can access or download. In most cases, the healthcare provider themselves will have that form and will fill it out alongside of you. We can certainly, somebody that needs a post form can certainly request one from us, and we will provide it to them, and theoretically on a case-by-case basis. So now with the new registry, a provider can real-time digitally create a post, and both the patient and the provider can sign and essentially upload that document, and it's in effect at that time. All right, so some other forms that are available. The Advance Directive Registration form. This is a required form. It's what allows us to store your advance directives and your post document. So you can look at it like a permission slip. You're letting us store your information. On the form itself, there's some fields that are required before we can register those documents. So on the form, it is, there are the fields that are required are identified as being required. Those are going to be your first and last name, of course, your date of birth, your address, your gender, phone number and email address, and of course, a signature. So talking about the email address, we'll actually circle back around to that and discuss a little bit more about the significance of having that email address and kind of why it's important. So the second form is the Healthcare Directive Registry Assistance Form. This form can be found on our webpage. Its primary purpose was for individuals that were registered with the Secretary of State. And as their documents transferred over, this form allows us to link their email accounts to those documents. But we found that we can also use that form for new registrants. So if you just need an extra hand to build your account, you can certainly fill that information out. We'll build the account. However, we won't be able to upload any documents simply because we haven't been provided any documents to upload. So all in all, this assistance form is just that. It's another option or another way for us to provide a helping hand and kind of walk you through the process and to ensure that you get your advance directive registered. Right, so this is our web page. Now this is not the registry page. So as you may have noticed, maybe the first thing that caught your eye was the length of the web address. It is quite long. That's something that we are working on trying to kind of narrow down because it is quite a bit of information to type in to access our site. So another option, if you want to access that site, of course, is you can email us, which at the end of this, I will provide our email address. You can email us and ask for a direct link to that site. You can also access it through the Idaho Department of Health and Welfare page, which would be located under the birth and marriage certificates and death records section. So what's in this site? The website content is provides descriptions of the registration form, the advance directive, durable power of attorney for healthcare, and the living will, and again, information about the post. There's even some general resource links and frequently asked questions. One in particular is the comparison. If you still have questions about the difference between a post and an advance directive, there's a form that breaks it out step by step on what the differences are. So additionally, on our website, if you are just kind of exploring and then you want to go to the registry page, you can certainly, there's a direct link which will take you to that web page, the registry page. And that's where you can either self-register your account, or if you're already registered, you can use it just to log in and view your documents or make any changes that you'd like. So again, we are in the process of reducing the size of that email, or excuse me, that web address. But again, it's something that is added to our list essentially of processes that we're continuing to refine. All right, so just a quick recap. We know what the registry is. We know the importance of advanced care planning and why we want to do it. And we know the forms that need to be completed in order to register those documents. So now we can kind of put it all together. One of the highlights or features of the new registry is you can create your advance directive all online if you choose. It's a very simple process, and I'll kind of walk you through here shortly on how to create an account, and then point you in the direction of how to create an advance directive if that is something that you want to do. So that being said, if you, for whatever reason, cannot complete your directive online, you will always have the option to mail or scan and email your documents, and we'll definitely get it taken care of. Right, so kind of how I mentioned, we're going to walk through how to create an account here shortly. This is what the registry homepage looks like. It is referred to as the patient portal. It's maintained by Vinca Health. And one of the reasons I've mentioned that name, Vinca Health, a few times is during the registration process, you are going to receive an email from them. And in some cases, it we'll say no reply at Vinca Health. So we've actually received quite a few phone calls coming into our office from consumers that are just, they want to confirm the legitimacy of that email and the sender themselves. So again, kind of stressing the importance of seeing that Vinca Health, they certainly are associated with us and with the registry and are a trusted sender. And so again, you can see the direct link. It's much shorter than our webpage, a little more user-friendly. All right. Right, so this is where we can actually start going through and creating an account. So from the previous web address that I had there, you'll go to, this is the start point, if you would, or the home page. And so I want to point out real quick, I don't expect everybody to memorize this process. Really, it's just an opportunity for us to provide you with an opportunity to kind of see how user-friendly the system is and give you an idea of what to expect if you do decide to build your account. So the first thing, of course, is highlighted. If you don't have an account, you're going to click on Create an Account. All right. So you're going to fill in the required information. It's just first name, last name, gender, date of birth, email address, and phone number. So as I mentioned earlier, we will circle back around to the email address piece. So in order to utilize all of the features associated with the new registry, each user needs to have their own email address. So for example, if a husband and a wife have a shared email account, we can only activate one of those accounts. So that being said, both accounts would be visible by healthcare providers. It's just the user themselves would not be able to view their documents. So again, if you don't have an email address, you know, that's fine. We'll certainly we will register your documents. We'll get them uploaded. Again, healthcare providers will have visibility on them. But again, those features that that we'll talk about here in a little bit, they just won't be available. So moving forward, from this point, once you've filled out your information, you're going to click on Create an Account. Once that's done, you'll see kind of a message banner. It's telling you just to check your email. So you'll see here, I have Vinca Patient Portal at gmail.com. That's just a test account that we had, but your email address would be in there. So it's giving you the next step of what to do. All right, so just like it says, we're going to check your email, and you'll receive a verification email from, again, no reply at vincahealth.com. That's why we wanted to kind of familiarize you with that name. So as you can see, kind of highlighted down there, I actually pulled that out of my email account. That particular one was Gmail. Any email account is fine, but that's kind of what the notice would look like. So you might not, because it just says no reply, you know, I could see why there might be some questions about its legitimacy, but again, I just want to assure you that that is a trusted sender. All right, so you open the email, and this is an example of what that email contents will look like. So at this point, if you have any questions, concerns, just need a helping hand, our contact information is right there. You can give us a call, send us an email before continuing. Whatever questions you have, we'll be happy to answer for you. So here, highlighted, you'll click on verify your account. And it's going to automatically direct you to the registry page to create a password. So your email and password moving forward are going to be what you use to log into your account. So just a key piece about the password, kind of similar to some of the other passwords that you might have for a bank account or even a music account. The passwords require certain characteristics. So you need to have at least one lowercase, one uppercase letter, a number, a special character. So I would just keep that in mind when you're kind of thinking of those passwords that you would like to add. All right, so once you create your password, you'll be directed to your new account. I recommend from this point, adding this page as a bookmark to your browser. That way, a month or two from now, if you want to look at your documents or add new documents, you can simply open your browser and click on the bookmarks, and it will take you right to that page. All right, so as you can see, the little blue house up in the upper left corner is that's the home page. You have the next feature, which is your My Documents, which we'll take a look at, and then My Shared Circle, and we'll talk about, again, that feature here shortly. All right, so at this point, if you do not have an advance directive and you want to create one, the system will walk you through that process. So you'll just click on Let's Begin. And if you already have one and you simply want to upload it, we'll talk about that as well. But if you already have one, you can just click on My Documents and then begin the upload process. But again, we'll talk about that in just a moment. So no advance directive, you want one created, we're going to click on Let's Begin. And at this point is where you'll create your advance directive. So to align with Idaho code, all the questions that are seen here on the form and any decisions that you can put in there, they're optional, including adding the healthcare agent. But as we previously talked about, there's an importance in having a healthcare agent. The one thing it absolutely requires is your signature. So how do you sign a digital form? So your signature can actually be done with just using the mouse on your laptop, or if you have a different mouse, you can sign your form that way. Or there's a feature where you can link and enable your smartphone, and then you're going to be using your smartphone as a signature pad, and you just sign it with your finger. It's some pretty neat technology there. All right, so I'm kind of moving over a little bit. Like I mentioned, if you already have an advance directive and you just want to register it. So we're going to skip that part where it says Let's Begin, and we're just going to go right to the My Documents piece. All right, so uploading documents is very easy. So there's 3 categories that I'll show you here shortly. There's a category for the post form, a category for advanced directive forms, and then another for just other forms in general. Really isn't something that it is utilized. So you're gonna select the menu button there. Just look at the 3 vertical dots and of the category of the document type that you want to upload. So in this case, if you want to upload the advanced directive, you would go to the menu button of the advanced directive. A drop-down list will appear, and then it's going to provide you the option, as identified here, to upload that form. All right, so of course, depending on the type of computer you have, this might look a little bit different, but one way or another, your computer is automatically going to pop up the browser, or excuse me, the file search directory. And this is where you're going to select those documents that you want to upload. And so once you select that particular file or document, the system is, or the program is going to ask you just to confirm a few things. So the first being the document type. Even though in the beginning we said we're uploading an Advance Directive, it's going to ask you again just to make sure, and it's going to give you a chance to look at that document and just to double check to make sure it's either the Advance Directive or the post. The ownership of the document. Again, it's confirming the documents belong to the owner of the account so that the correct documents are being uploaded to the correct person. The last thing you want to do is upload maybe your significant other's post form to your account. Of course, it's correctable, but this just gives that option to verify it ahead of time. It's going to ask that all signatures are present on the form. That would be the signatures on your registration form, on your will, and your durable power of attorney for healthcare. And then the effective date of the document. So not the date that the document was uploaded, it's the date that you signed that document. So for a post, it would be the date that the physician signs that document. All right, so once you complete that form, your upload process, it's going to take you back to your My Documents area. As you can see there, it's going to provide a thumbnail or just a small image of the document that you uploaded, and it will mark it as current. That's your current document. So if a week later you came in and uploaded another form and kind of changed some things, it would mark that previous document as prior and then put the most recent version of that Advance Directive on top and mark it as current. So there's that would be the version control, just to assure that there's just one single source of truth. So a healthcare provider or a family member is not digging through all the documents trying to figure out which one is the most current. So I kind of mentioned beforehand, there's those 3 categories that you can choose from when you're uploading documents or when you're viewing documents. You see the post category, and it has its own menu button, the Advanced Directive category, and again, own menu button, and other Advanced Directive, and something that's not really utilized, but we have it there in case there's maybe another document that you want to include that doesn't really fit in the area of the other 2. All right, so a couple of the other features, and I'll take a step back and point it out to you specifically, but my shared circle. So this is where you can add family members. They'll have the ability to view your documents, but they won't be able to change those documents. So by simply, and again, I'll step back here real quick where it's highlighted my documents, or excuse me, right next to where it's highlighted my documents is my shared circle. That's where you would click on that. You're going to add their name and their email address. An automatically generated email is sent to that individual. They will create their own, not account, but access to your account. And that way they can view those documents. So instead of having to send your Advance Directive through mail to somebody in New York, a relative, or your healthcare agent, you can simply add them here, and it sends them an email and tells them, hey, so-and-so would like to add you to their shared circle. Another feature is the free text. So you're not limited to just putting a 1 sentence in for your special provisions in your Advance Directive. So it provides you now with an opportunity to really line up what it is that you want with all the details that you want. All right, so like I promised, we have the contact information here, ihdr@dhw, excuse me, .idaho.gov. That is the registry's email address. We have multiple people monitoring that inbox every day, every day during the work week. If you have any questions, you can send us an email there, or you can give us a call. As you saw earlier, our a little bit longer of a web address, and then of course the health and welfare web address as well. So I see there's quite a few chat questions going on. So I'll take a look at those in just a moment. So as we move into some of the questions, I thought I would toss a couple out there that have already, that seems to come in quite frequently into our office. So the first one is specifically refers to individuals that were registered with the Secretary of State. When you registered with the Secretary of State, you were given a card that had your name and your filing ID number. And in theory, a healthcare provider could reference that ID number and find your healthcare directive. That's not a service that we do anymore. We found it to be more efficient for just a healthcare provider to look that information up just by your name and date of birth at the hospital. Is there a cost? So at this time, there's not a cost. I say at this time because you never know if down the road we might have to charge a service fee. I know there's a couple of other states that charge, I believe, like a $3 filing fee. But at this time, again, no cost to you. So another question, can other states see my directive? So this directive is specific to Idaho. There's been talks about doing a national directive, or excuse me, a national registry. I personally haven't seen any progress with it. So if you, if there's a state that you travel to quite a bit, I would recommend just filing a directive with that state as well. Again, because for the most part, filing with these states it's a free service. So I'm actually going to go back here just because I want to provide this slide for our contact information. And then we will take a look and see what kind of questions we have here. Oh, and also, if Kathy, if we can, if people have other questions, you can certainly unmute them so they can ask those.
Yeah, Chris, if someone has a question, they can just raise their hand in the reactions area.
Oh, I probably didn't want to do that. All right, so I'm going to share this screen again real quick. And then again, go back to some of these questions. So, excuse me, it looks like Cynthia was kind of taking care of some of these questions.
So one of them was, yes, the video recording of this session will be available. We're going to put it in our regular YouTube channel, Kathy?
Yes, it will actually be on the ARP YouTube channel.
Okay.
In Idaho. Mm-hmm.
Okay.
Right, so it looks like one of the comments here at the end of the presentation, just re-emphasize that the documents only go into effect when an individual is incapable of voicing their wishes. That is correct. That would be the only time that these advanced directives are used or put into use. At what point does medical staff start looking for advanced directives? All right, so this was kind of, I don't want to say a myth per se. It just wasn't necessarily accurate about the previous system, where some individuals thought that in a crisis scenario, if an EMT showed up to the door and found the card with the filing ID, that they would quickly reference that card and see if there was an advanced directive. It just wasn't possible. EMTs don't have that that capability then. They don't have it now, unfortunately. So at what point do medical staff start looking? I absolutely would have to double check. It might be different depending on what facility, you know, from northern Idaho to southern Idaho. Each facility might do it differently. But we are providing training to providers, to healthcare providers. We're providing them with access. So theoretically, they, again, they would know how to access these documents and look at the accounts.
Chris, this is Sheena. Part of that confusion comes from, I think that we have been told you should have a post specifically, nothing else, a post on your refrigerator. And so that is part of the confusing part, because you can also have the post in this registry. And so I think that's what makes people a little confused about that.
Exactly, and I've heard that before as well. However, you know, I guess it would be hard pressed to see an EMT take the time to look at the refrigerator to see if there's a post on there for maybe like a do not resuscitate type order. I know there's things that you can do. You can get a medical bracelet, not through us. I'm not sure if hospitals still provide those, or you can order one, you know, that specifies like do not resuscitate if that's your choice. But as far as it goes, the EMT is going to do what they can to stabilize you until they can get you to a hospital. And then from there, hospital staff would take a look at the registry and see what is on there. But again, kind of going back, I would imagine that it's different for each hospital as to at what point they start researching that information. If you create an advanced directive on the site, can you print it to give to healthcare providers or facilities? Absolutely. And so you can either print it, or you can just let them know even that you do have an advanced directive and that it is registered. Whatever is, I guess, feels the most comfortable with that individual. Oh, so let me add a quick piece here. I do have a few items that I can certainly hand out that would include the difference between the advanced directive and the post form. And as we went through the kind of step-by-step on how to create an account, I have that available as well. And this presentation, and then the advanced healthcare worksheet that can kind of walk you through identifying some of the items that you want. So I would take a look at that email address. If you want either this presentation, those forms, unfortunately, we can't just blast it out to everybody. So if you want them, just shoot us an email, and you can certainly ask for, again, this presentation or those documents, and we'll be happy to provide them. So I'm not sure if we have enough time to keep going through some of these questions.
Yes, we still have a few more minutes.
Okay.
If folks have a couple more questions, yeah.
All right, so this one from Brent, does this require a separate registration from the Idaho Department of Health? So just the registration form that I referenced earlier, that is a required form because again, that's what allows us to store your information. When the documents are needed, no one has to have the password correct for me to use and create my account. All right, so when the documents are needed, healthcare providers do not need your password. They already have access to your account. And so again, they simply look up that information and can see the directive. The password is just for you. That way you can access the site and make any changes or do any sharing that you'd like. Oh, it looks like Cynthia backed me up on that one.
Yes, yes, you did, yes.
Do you have to scan documents to be able to upload them to the registry? So it's kind of a two-part. I want to say yes and no, because there is that option to create the directive through the new registry itself. That's one way, and then the second way would be yes, you can scan those documents and upload them, or you can always email us those documents or just put them in the mail. And on the registration form is our mailing address. So you can certainly just send those standard mail and we can scan them here and upload those to the account. Is there a way to get, let me see, is there a way to get help with the living and samples of the form? Yeah, absolutely. So as far as help goes, I would recommend seeking an attorney that would help you kind of walk you through that process of how you want to complete those forms. I here we can't give you any real directive on how you should fill it out. Obviously, it's going to be different for everybody, but I would guess that there's probably a handful of attorneys or a source through the state that could provide just a free one-on-one on how should I do this. But again, you can certainly email us and we can do the best we can to kind of help you out. So facilities asking for a copy. When will facilities have access to that training? So they actually had access the same day that we did. Mind you, we're continually adding organizations and building these accounts for providers to kind of increase that net of who can view it. But it is something that we do have to manually go in and add that organization so they can see the patient's documents.
Okay, any other questions? I don't think I see any more in the chat. Chris?
I know there's a handful that unfortunately we might not have time to get to, but again, please either give us a call or send us an email and we can certainly answer any questions that you may have.
Getting a lot of thank yous and super educational, Chris. So thank you, you and the team. Kathy, there's a question about access to the recording to the YouTube channel.
Yes, that if you just Google ARP Idaho YouTube, you should be able to find it. And I think there's a link on our website.
Okay. Good, good, good. Okay. Well, if there's any other questions, you certainly have Chris and Cynthia to send messages to. You have the information to connect with them. Thank you so much, you guys, for this information. I think it's been very helpful to know a wealth of information for all of these guys. So if there's any other questions, please do contact them and let us know if there's anything else we can do for you. And thank you, Chris and team, for volunteering to do this for AARP and the community.
Absolutely. Thank you so much. I really appreciate it. And just one quick thing with Veterans Day tomorrow, I just want to say to the veterans and their families out there, or the families of veterans, happy Veterans Day. Please enjoy.
Right back at you. Thank you, sir.
Thank you.
Okay, thanks everybody. Goodbye.
Bye.